Hi, this is Dr. Paul Goldberg of the Goldberg Tener Clinic, right outside of Atlanta, Georgia. Today we're going to be seeing an interview with Miss Karen Carson, who came to see us about 16 months ago with severe rheumatoid arthritis. Miss Carson has been suffering with this problem since she was about 32 years of age. She's now 68. Working with her for 16 months, we're going to see how she's doing today. We've been working with patients with rheumatoid arthritis and other autoimmune conditions since 1976, with good success not in treating these conditions, but in actually reversing these conditions and bringing people back to good health. Let's look at the interview with Ms. Carson. So we did a re-exam today on Karen, and Karen originally came to see us in April of 2021. Today it's July 2022. And she was diagnosed with rheumatoid arthritis. And so, since we only saw you for the first time in April of 2021, you had a number of years where you were under medical care for this condition, correct?
Yes.
And during that time, you had taken a number of drugs. Let me see if I got this right. There was prednisone, which is a steroid. You were on methotrexate. You were on Remicade. And there were probably some painkillers perhaps mixed in there. And also, you're on the old drug, they don't use it much anymore, Gold. You had taken Gold as well. Karen, tell us just a little bit about your experience for those years prior you had come to see us. And I know you've had some surgeries done as well.
I've had lots of surgeries.
Yeah.
I've had my feet surgeries, ankle surgery, knee replacement on one knee, and I just recently had knee replacement on the other side.
Right. What was your experience, what was your life like for the years prior to when you came to see us at the clinic about a little over a year ago?
It was pretty, I could do things, but I didn't have a lot of energy, was limited. There were things I would like to have done, but I couldn't do. I was starting to just feel old and tired.
I think the term you used for us, correct me if I'm wrong, was that your life was basically consumed by the rheumatoid arthritis.
Right, correct.
Right.
Yes.
And what parts of your body had it affected?
You name it.
Your hands,
wrists, legs,
knees. Right. As you said, you've had surgery now on both your knees and on your ankle and on your toes. So
both wrists.
Both wrists as well. Okay. So when Karen first came in to see us, we did a workup on her, an evaluation, case history, physical examination, and laboratory tests. And when she first came in, we looked at one of the tests we did was major markers of inflammation, which was a cardiac reactive protein known as a CRP, and that was at 3.84, which is pretty high when Karen first came in. The last time we checked, it was in February, it dropped to a 0.3, was it 0.37, Doc? 0.87. And we did a sedimentation rate, which was originally at 22, it's now at 8. Karen, can you just tell us briefly the difference from when you came in to see us to what's happened in terms of improvement to the current time?
I'm off of all my medicines.
You're off of all drugs now?
Yes.
Okay.
There's no inflammation. I can actually see the knuckles on my hands.
Right.
I can move better.
We had you fill out a little form here, and you just verify this form. You said that since you first came in to see us, you've had an improvement of 90%.
Correct.
That's correct.
Yeah.
Okay. So she's off all drugs, and the problem is that when you take these drugs, they can suppress some of your symptoms, but they lead to a lot of very, very horrific side effects in many cases. Steroids can lead to depression, cataracts, diabetes, thinning of the skin. The biologicals, which are so common now, the major issue we see with that is that they can create things like lymphoma, which is a type of cancer, and some people also develop secondary autoimmune disorders as a result of it. Karen, Dr. Tener and I are very, very happy about your improvement. And now that you're still a young person, she's younger than me, so she's a young person. We look forward to many more years of good health and continuing improvement for you.
Thank you.
You're
Thanks.
welcome.